In some of my more recent videos, I've talked a lot about the overlap between autism and ADHD with conditions like Ehlers-Danlos Syndromes and dysautonomias. But in this video, I want to talk about another group of conditions that very commonly co-occurs with EDS and dysautonomia, and those are the mast cell disorders. In particular, I'm going to focus on mast cell activation syndrome, or MCAS. Now, I first want to put out there that I am not an immunologist or an allergist. I'm a scientist with expertise in various areas of neuroscience, as well as some of the other systems of the body that may influence brain and behavior. I'm also a patient who struggles with MCAS, although thankfully I'm not on the really extreme end of that continuum. But if you want to learn more about mast cell-related disorders beyond this video, I recommend looking up papers by Ann Maitland and Lawrence Afrin, who are two big names in this field, and they maintain very active clinical practices treating many of these conditions. I also recommend reading books like Mast Cells United by Amber Walker, The Trifecta Passport, also by the same author, and Never Bet Against Occam by Lawrence Afrin for more in-depth reads. Okay, before we delve into what exactly is MCAS, first we need to understand what a mast cell is. Your body, of course, has a variety of different types of immune cells that help you to deal with infection, to get rid of tumor cells, as well as to aid in repairs after tissue injury. Almost all of your immune cells come from your bone marrow. You have lymphocytes, which are B cells and T cells that are part of the adaptive immune system that keep a long-term record of previous infections, hopefully allowing you to develop immunity. There's also another type of lymphocyte called a natural killer cell, and they're really good at killing cells infected by a virus or attacking tumor cells without first needing to be primed by other parts of the immune system. The next group of immune cells are phagocytes, and they mostly eat infected cells, hence the prefix phag, which in Greek means to eat or devour. There are also dendritic cells as part of these phagocytes that present parts of invading pathogens or tumor cells, which are known as antigens, to other immune cells in order to get them into attack mode. And finally, we've got mast cells, basophils, and eosinophils, which are all key in allergic and allergic-like responses and dealing with parasitic infections like intestinal worms or malaria. Out of all of these, mast cells are by far the most abundant cell type, and they're typically hanging out in your connective tissue and at the mucosal linings of your body, which are places like your respiratory and gastrointestinal tracts. Meanwhile, basophils and eosinophils exist in much smaller numbers in your body and typically hang out in places like the bloodstream, but they can be recruited to other sites of inflammation by your lovely mast cells in order to help further that inflammatory response. Basophils and eosinophils are more involved in short-term reactions and are important for triggering other parts of the immune system like T cells. But because they're primarily involved in short-term responses, basophils only live a few days and eosinophils only about 8 to 12 days until they all die off. Meanwhile, mast cells are super important for long-term inflammatory reactions, and they can live up to several months. What's more, new mast cells can be trained to become more or less aggressive over time based on previous exposures, and this training can leave marks on the epigenetic patterning of these cells, changing gene expression. So not only can a single aggressive mast cell live for months, the behavior of newborn mast cells can also adapt to become more or less aggressive. So we're basically constantly training our mast cells based on our exposures. That's how symptoms can become progressively worse or better. It really depends. But what do mast cells do exactly? When they identify a pathogen-associated molecular pattern known as a PAMP, or a danger-associated molecular pattern known as a DAMP, they dump a bunch of prepackaged chemicals into the surrounding area, leading to a host of inflammatory-related changes. They'll dump chemicals like histamines, which cause blood vessels to expand, to become leaky, and ultimately result in swelling. There's also cytokines and chemokines that promote inflammation and attract other immune cells into the area. There's leukotrienes, which in the respiratory system cause the bronchioles of your lungs to constrict and to produce produce more mucus to hopefully allow you to trap and cough up that invading pathogen or dangerous chemical. There's also prostaglandins, which are important in triggering inflammation, pain, fever, and are also responsible for making you feel sleepy when you're sick and may even be a major player in brain fog. And finally, there's proteases like tryptase and chymase that can help break down connective tissue. And yes, there may be links with that and Ehlers-Danlos and other hypermobility related conditions. Okay, so we now have a good idea about what mast cells are and what they do. But what is mast cell activation syndrome, or MCAS? MCAS is characterized by chronic overactivation of mast cells, usually in 2 or more different systems of the body and typically at the same time, although single systems can sometimes also be affected too. Now, why are we interested in that 2 or more systems criterion? Because it suggests that rather than inflammatory reactions being relegated to the local area of a reaction or a local site of damage, which is how it's normally supposed to be, inflammation is clearly spilling out into the body, triggering other mast cells in other regions of the body. So it's a systemic pattern of overactivation, and that is key to MCAS. The most common symptoms of MCAS usually include skin reactions like hives or flushing, gastrointestinal problems like nausea, vomiting, diarrhea, or GI pain and discomfort, respiratory issues such as shortness of breath, wheezing, or other symptoms associated with asthma, cardiovascular symptoms like rapid heartbeat and or a drop in blood pressure, neurological symptoms like headache, dizziness, fatigue, or brain fog, and finally, some people also experience anaphylaxis, which is a severe reaction that may create a variety of symptoms, including severe difficulty breathing and swelling of the throat. Now, people's symptoms and severity are going to differ, and it's definitely a spectrum. For instance, my biggest challenges tend to be respiratory, fatigue, and brain fog, but I still do sometimes get gastrointestinal involvement, and my skin can often be overly sensitive, and I may get flushing with a reaction. But there are other people who are on the more extreme end and may experience frequent bouts of anaphylaxis, so that severity can really vary. Now, what kinds of things trigger mast cells? Actually, it's hard to find many things that don't potentially trigger mast cells sometimes. At least that's the way it seems to me. And triggers really can vary by individual. They can include all sorts of foods, environmental allergens, indoor allergens, chemicals, perfumes and other odors, injury, alcohol, medications, insect stings, anything you might put on your skin like lotions and soaps, temperature changes, stress, anxiety, anger, and exercise. And some unfortunate people even react to things like sunshine, aka UV exposure, or even water. So as you can imagine, almost anything can be a trigger, and every person can be a little bit different. My personal Achilles heel tends to be pollens, but I also react more mildly to a bunch of other stuff too. Now, regarding treatments, I'm going to review some of the major medications used to treat and manage MCAS, but I want to clarify that typically people find the most success using a polypharmacy approach. In other words, using combinations of medications together. Each of these meds are going to do slightly different things, which is often why this polypharmacy approach works best. It's also good to have some meds that you take every day that help you keep at a general baseline, and then to have one or more meds that you use as a rescue on the inevitable days that you're struggling with breakthrough symptoms. Okay, with that being said, what are the potential treatments? First off, hopefully it goes without saying that you should, 1, try to reduce your exposure to stuff you know are triggers when possible, or 2, pre-treat with meds when avoidance isn't a good option. Okay, that's the first thing. But what about meds? Thankfully, some of the foundational meds for MCAS are over the counter, so you don't need a prescription. And those are H1 and H2 antihistamines. H1 antihistamines are meds like Zyrtec, Allegra, and Benadryl. The newer H1s, like Allegra and Zyrtec, don't really cross the blood-brain barrier all that much, so they don't have quite the sedating effects that Benadryl has. Now, the H2 antihistamines are meds like Pepcid. Most people tend to associate Pepcid with treating acid reflux, but its main mechanism is actually as an antihistamine. Just think of the increased acid production as the stomach's version of a runny nose. Next, we have mast cell stabilizers, which help mast cells to calm down. Those are prescription meds like ketotifen and cromolyn. Cromolyn can come as an inhaled form to treat respiratory issues or as a liquid form to help with chronic diarrhea. If your local area has a compounding pharmacy, you may even be able to get a cromolyn pill compounded, which may be a better alternative for those who suffer from too much constipation when taking liquid cromolyn. As an aside, the supplement quercetin can also be a useful mast cell stabilizer, and it's a good antioxidant to boot. The only caution there is quercetin can suppress thyroid function, so if you have thyroid concerns, be cautious with this supplement and get your thyroid checked frequently or use the other alternatives. Another group of meds are the leukotriene antagonists, like prescription Singulair. These can be especially helpful for respiratory reactions, including asthma, but I will just warn that this medication can be challenging for some folks to tolerate because the brain also has leukotriene receptors, and going through sudden withdrawal when first taking the medication can cause major mood and or anxiety issues. Caution is especially advised for use in kids and teenagers. Now, me personally, I had a hard time that first week I was on Singulair, and it did cause some pretty challenging generalized anxiety, but I would say by the end of the week my brain had adjusted and I found it a useful medication to add to my MCAS regime. So, some folks have a worse time than that and they really can't stay on it, while others don't seem to notice side effects at all and they can tolerate it fine. So it really just varies by person. Now, non-steroidal anti-inflammatory drugs, or NSAIDs, can also be helpful for some people, although this is one of those med classes that can unfortunately be a mast cell trigger as well. So while these aren't used quite as commonly in MCAS for that reason, some people do find relief from them. I personally use Aleve as an occasional rescue, but I can't do it too often because it tends to give me ulcers. Other folks may actually have an allergic-like reaction to NSAIDs, so definitely use your best judgment and listen to your body. The same goes for steroids. Most people aren't on steroids chronically because of side effects, of course, but also be aware that this is an immunosuppressant medication that tends to be a mast cell trigger. That can be either in oral or inhaled versions. Now, for me personally, I was prescribed a steroid-based nebulizer, and the second time I used it, I had a really horrible reaction with some of the worst shortness of breath I've ever had. Needless to say, I've stayed clear of steroids since then. Now, finally, some people have had success using low-dose naltrexone, or LDN. Although it can often be difficult to find a physician willing to prescribe it for an off-label condition like MCAS, but it's pretty good at suppressing the cascade of inflammatory reactions that are propagated by mast cells and other innate immune cells. So if you do have a willing doctor and you're having a lot of trouble managing your symptoms with the other meds, you may want to look into LDN. I also want to mention that when it comes to MCAS, we can often be medication sensitive. Sometimes we're sensitive to the active ingredients in the medication itself, which sucks if you're reacting to some of the frontline MCAS treatments. But also be aware that companies tend to add a bunch of different fillers into the medications, so it's possible you could also be reacting to the filler itself. If you suspect that could be the case, a compounding pharmacy that avoids the use of fillers can be really invaluable. If you think you have MCAS symptoms, you may be wondering who to go to in order to get assessed. Now, it can be really hard to find an immunologist or allergist who has expertise in diagnosing and treating MCAS. Honestly, most of them just look at you like you've grown a second head. But I do recommend going on to the Mast Cell Disease Society's website and use their Find a Physician feature to see if there's anyone in your area. Hopefully, as time goes on, more and more physicians are going to take an interest in this group of conditions, and it'll get easier to get the support and care that we're really needing. In the meantime, however, integrating some of the over-the-counter medication options may help you find some manageable relief until then. So just double check that they're not contraindicated with any of your other medications that you might be taking, and if you're not really sure, you can always talk to your doctor. Anyways, I appreciate your interest in this video and in MCAS, as well as this trifecta of interrelated conditions. I do plan on continuing to add similar videos to the channel in future, so just let me know down in the comments if you have any questions or comments or even other video ideas kind of along these lines. So again, thanks for following me down this this science rabbit hole. Always going down the rabbit hole, aren't we? So until next time, I look forward to it. Take care and ciao.